We are welcoming to the studio our startup success story, Fodhil Benturquia. He is the CEO and founder of Okadoc, which is an instant online appointment booking system for patients. Fodhil, how are you? Thanks for joining us.
I'm doing very well. Thanks for having me today.
Fodhil, it's brilliant timing. We've just been interviewing someone who delivers sugar to the kids and burgers, and now we can book a doctor's appointment.
Exactly so. Now, why did you start Okadoc? Because I know you've got this extraordinary pedigree. You worked for Souk.com, you've worked for Noon.com. They are the biggest .com brands right here in the UAE. So obviously any startup you were going to do would be good, but you turned your attention to health medicine effectively.
Absolutely. I love the e-commerce journey and solving some of the problems and bringing a better experience to consumers, being able to deliver products to their home was really incredible. I just got we work a lot in e-commerce and in most of the tech startups, and you just work a lot and you get sick as anyone. And I just try to book an appointment, and I just got used to everything digital. From booking, buying the product online, booking your Uber or Careem, your drive, getting your food delivered. And when you get sick and you try to book an appointment, the whole experience becomes, different. And it took me 15 minutes not to get an appointment. Just called during working hours, press 1 for English, 2 for Arabic. A lot of time if you press 2 for Arabic, nobody speaks Arabic, but it's just everybody got the same system in place. And you end up not getting an appointment. I just realized that if you can offer millions of products online that you can get customers to buy in 30 seconds and get them delivered in a couple of hours, why can't you get just an online appointment with your doctor, right? And this was really the starting point.
There's a book, and it's called The Patient Will See You Now, rather than the doctor will see you now. So I guess you're empowering the customer, aren't you? Is a lot of this allowing the customer to choose someone? Is it based on customer reviews?
Yeah, so it's really empowering all the customers, right? Because we feel and we believe that healthcare is a relationship between the doctors, the healthcare providers in general, and the patient. And we really wanted to build a platform that is customer-centric, where the customer is at the same time the patient, the healthcare provider, as well as the insurance who.
So let's say I'm looking for an ENT specialist.
Yeah.
Okay, how would I use your product to help me find the best one for my purposes?
Absolutely. So what we've done is search and match was really an important problem that we wanted to solve. We wanted to have really a relevant search result. So for example, we've got search by specialty, by availability. You want to say, I want somebody available this afternoon or at this particular time, by location, by spoken language, by country of education of the doctor. The UAE population is so diverse. You always want to see a doctor that understands your background, your history. So those filters and capabilities have helped a lot the patient in finding most probably a doctor that is really relevant for them.
You've come a long way. I mean, you're definitely not a startup anymore. You've partnered with Medcare, MediClinic. Last year, Saudi Arabia's Bupa Arabia has poured money into the business. How many healthcare facilities are you now affiliated with?
Yeah, we are about 300 facilities in total in UAE, Saudi, and beyond, actually. And we have over 3,000 doctors available on the platform. We have built a platform that allows patients to be on the Okadoc platform and see all those facilities, but we also provide white label solutions that are available on websites and mobile app of healthcare providers and give that same experience to patients wherever they are. So wherever they start their journey, if they start their journey on the website of a clinic and hospitals, they'll have this 30 seconds appointment instead of 15 minutes, and they will have it on Okadoc platform marketplace, but they will also have it on the insurance mobile apps.
And Fodhil, does Okadoc, does it have a rating system, an out of 10 for each doctor?
Yeah, so we do capture reviews that we share with the healthcare providers for them to know what patients, how their experience went, what are the things they need to improve, so on and so forth. As of today, we haven't made those reviews public because we feel that they can be sometimes quite subjective.
So I think increasingly we're seeing in businesses the Google reviews and the rating out of 5 is increasingly used by customers to help them choose. But as a business owner, it's a constant. You want to be open and show that you're open. But of course, when you're criticised, it's not such a nice thing, and particularly, I suppose, when health is involved, it's overly delicate.
It is delicate. I think it's easier to rate maybe a facility service like waiting time or some bed manners or things like that. But I think when it comes to rating an individual, like a doctor, for instance, it can be quite subjective, and with healthcare, it's quite sensitive.
But the customer would certainly prefer it, right?
Absolutely.
They'd prefer to see an out of 10 rating, whereas your business-to-business customers would perhaps not prefer it. So there's your dilemma.
You're absolutely spot on, and I think you're touching an important point. We're working on a way to provide patients with something that is transparent and fair. But what we've done is a lot of research. We really focus on quality, and we feel that, for instance, because we're very diverse in the region, we see that a lot of people will have different criteria of what is a good doctor, right? Sometimes a good doctor is somebody who gives a lot of medication, and some cultures is maybe the opposite, right? So really finding, those kind of transparent.
And how do you
criterias.
deal, Fodhil, with there's quite a lot of, people know that the insurance networks play a very large part in this business. And so they, may view things as, is this because a certain insurance company recommends this particular product? There's an allegiance or alliance there. How do you deal with that sort of cynicism of the consumer?
Look, consumers, or let's say patients, they've got an insurance, basically usually with a company or they are sometimes self-insured, and they've got a network, right? Yeah. What we really wanted to do is solve that problem of giving access to somebody who might be sick and have an appointment in 30 seconds. And with the insurance, what we've done is really we provided that white label solution, but that allows the member of the insurance, when they logs in, they can see directly the in-network doctors and have the same experience, but only with their in-network doctor. So this is really the problem we solved. We haven't solved the other problems yet, but we're looking at that.
As our sort of inspirational success story, obviously you're talking from a position of strength now. You've made it. The company's doing really well. You've got lots of companies, lots of health companies to sign up to your systems. But were there times when you thought that Okadoc might not work?
We've never thought that it might not work, because we really believe, myself and the team, that it's such a rewarding mission and work that we're doing. Waking up every day and seeing that millions, of people every year are using our platform and having this time saved. We also reduce significantly no-show. We reduce no-show by up to 75% to healthcare providers. So the satisfaction for doctors and providers is incredible as well. So really, for us, we believe that as long as we're solving very important problems, the company should not fail. But we always wake up also with the mindset of it is changing so fast. Healthcare is changing. The digital world is changing. We've got to adapt every single day. So we keep on our toes every day.
I've got a request on behalf of the UAE population, and particularly on behalf of startups where money's important. Mark Cuban just launched a pharmacy brand in the States that is charging about 10% what most of the other pharmacies are charging. So let that be your next project. What do you think?
I mean, what is your next project? That's what's so interesting. Are you going to consider that type of...
I think maybe there has been some leakage or something like that, but we're working on something.
Well, you make sure you set it up with Virtuzone.
Absolutely, absolutely.
I mean, we were going to ask you, what are you working on right now? Is that one of the businesses, or have you got several? I mean, because you really are, one of the most well-known techpreneurs here in the UAE. So it's really interesting to know which pies you've got your fingers in, basically.
No, of course. Look, we, at the very beginning of COVID, we were already working just before COVID on telehealth, and COVID has just, incredibly created that adoption, and we're really on time. Today, we're working on two major products. One of them is home healthcare, right? So building those technologies that allows you to get your services at home. So we started with the PCR test, working with labs and providers, and bringing that always on time experience, but we're taking this to labs, to having doctors, nurses, so on and so forth. So having that technology to deliver healthcare at home is a third delivery care method that we're working on. And definitely pharmacy delivery goes with that, especially for, when you already sometimes spend time in the hospital or the clinic, you don't want to wait or queue for another 20 or 30 minutes to get your medication.
You must get lots of pitches from aspiring techpreneurs. Do you get excited by their ideas? Have you ever been tempted to invest money in them?
Oh, absolutely. I think it's incredible. We talk to a lot of startups. We try to do, cooperations. We try to partner with them. The energy, the level of ideas that we see in the region, in UAE, in Abu Dhabi, Dubai, in Saudi Arabia, and the overall region is just incredible because we've got such a young population that is mobile first, that is tech first. That so they kind of, everybody comes up with ideas and you're like, this is fantastic. We haven't thought about it, right? Like, and it's always incredible. We either want to invest or we want to work with them, or we always want to interested to explore partnerships.
One of the things I like about your story, Fodhil, is obviously data is incredibly powerful, right? And health data about individuals is some of the most precious and that needs to be treated with the most care. But you've got something that you can grow complementary businesses from, right? Is that a deliberate part of your strategy?
Yeah, of course. I think data is very important for this daily decision making. And I think the type of data that we have is incredible, especially that we connect with the hospital information system, the EMRs, and we've got very good coverage as well, and volumes. We are also very cautious about data, and I can tell you we're about to announce it, but we just got the ISO 27001 certification in 4 countries, which is a very high standard of compliance, governance, and data security. For us, really, before talking or using data, for us, it's very important that it complies. And this is what allows us to work with listed companies, with very large groups, so on and so forth. Yeah.
That is very interesting because, oddly enough, the one question that we've had in for you one of the questions we've had in on 4001 is from Finn. She was like, great show. Where are the medical records stored? So that gives you a sense of just how important data protection is in the sort of field of health for people. Now, I'm being told I've got to wrap it up. I'm so sorry. It's been an absolute pleasure speaking to you. We could have carried on for hours, couldn't we, Neil? So much to chat about. Fodhil Benturquia, the CEO and founder of Okadoc, an instant online appointment booking system for patients, obviously an extraordinary pedigree, worked for Souk.com before Noon.com, and a real pleasure to speak to you, sir. Thank you for your time.
Likewise, thanks for having me.